Here's another type of pathology that can happen, because sometimes the fertilization of the egg doesn't happen exactly where we would expect it to. So as we said earlier, usually the egg is in the superior part or just at the very opening of the fallopian tube as it enters the uterine cavity, or the endometrium and endometrial tissue is exposed. And sometimes the egg and the sperm meet in a different spot. In this particular situation, in an ectopic pregnancy, and what you see illustrated here, the fertilization has occurred not in the uterus and the endometrium, but actually in the fallopian tube. This is about 1% of all pregnancies, so it's very small, it's very infrequent, I guess is what I want to say. A very small population of people experience this, but yet frequent enough to be of concern. It occurs most commonly in the fallopian tubes, and sometimes it's known as a tubal pregnancy. The patient is going to exhibit all the signs of very early pregnancy, I should say. Even a pregnancy test will indicate that there's pregnancy there. However, that fallopian tube is very small. And as the fetus begins to develop within the first very short period, we're talking days or probably a couple of weeks, it starts to develop. And of course, if it goes any further, it's going to rupture. It's going to rupture the fallopian tube. It's going to be dangerous to the mom. So this is one of the situations that if someone knows they're pregnant, even if they don't, but they're having severe sort of medial to slightly lateral pelvic pain on the anterior of the body, and there's a few other symptoms involved, it is really time to get them to an emergency room. They are going to need emergent care and hopefully won't have any complications as a result. However, complications are very much a possibility. Assuming the other way around, that the egg is embedded in the endometrium, fertilization happens, pregnancy occurs, and you have the entire gestational period, we come to the actual birth itself, and let's say that the birth is more difficult than expected. Using the prefix dis and the suffix tosia, the word comes together, dystocia, difficult labor or childbirth. I've witnessed a few childbirths, and I can't say any of them were extremely easy. When our son was born, it was 12 hours of labor, pardon me, and he crowned 6 times, which means the head started to come out 6 times and went back in. He was quite a battle. My daughter came out in one push. So who's to say, right? It's a different experience for every woman. The point is that mom and baby are safe however it happens. So here's a procedure that can also happen. This does tie into that idea of why, meaning procedure. So the perineum is the area between the vulva and the anus we see illustrated here. And so it's that area. And episiotomy is an incision of the perineum in order to allow a fetus to come out. We see an example here of 2, and the only 2 that I know of, the midline incision and the medial-lateral incision. So in this case, and it's done frequently, when the mother wants to give natural childbirth, they want to avoid a C-section if at all possible, but the baby's head will not make it through the vaginal canal. They make this incision. Sometimes the incision grows in size as a result of the baby pushing through. So, and there's a healing period, of course, after this, but it's one safe way to get the baby out without having to go into the OR. They usually perform this right in the room. They just a quick incision with a scalpel, and the baby comes out, hopefully, and everybody's happy and good. So that's one procedure that might be associated. Now, the other side of that is maybe an episiotomy isn't possible. The mother doesn't want it, or they have selected to do this type of birth, which is a C-section, cesarean section. This is a surgical procedure. This will happen in the OR. If it's an emergency, they'll take the patient to the OR right away and perform the surgery. As I said, some births are planned this way, and that might be for safety reasons, or there are a variety of reasons why this might be a scheduled procedure. But not all births happen vaginally. Not all of them happen in the traditional setting. And a C-section, there's an incision made. The entire amniotic sac is brought to the surface. It's cut open, the baby taken out, and then everything's sutured back together. So this would be another variation of a special procedure that would be required to make sure mom and the baby and everybody comes out safe and happy. No judgments in birth, just that everybody is safe and happy. That's the primary goal. Circulage. So here's a different type of procedure. This is where a non-absorbable suture used to hold the cervix is placed. Pardon me. Let me start that over. Circulage is when a non-absorbable suture is placed, and it's used to hold the cervix closed during an early pregnancy. It's used to prevent a miscarriage, which another name for miscarriage is a spontaneous abortion. And this is a term that's always kind of bothered me, this next term, because it sounds like someone's done something wrong. It's used to prevent a miscarriage in a woman with an incompetent uterus. Incompetent uterus is a strange phrase, I think, personally, just my own personal thing. It's almost like somebody's done something wrong here. Honestly, an incompetent uterus just simply means, for whatever reason, the muscle tone or the cervix itself can't seem to hold tight enough to hold a fetus in, especially if there's been one miscarriage previous or more. A cerculage is a very suitable and applicable technique in order to make sure that a subsequent miscarriage doesn't happen. So that's what you need to know about this word. There's also a DNC. There's an abbreviation that stands for dilation and curettage. This is a surgical procedure in which the cervical canal of the uterus is widened using dilation, so the endometrium in the uterus can be scraped with a spoon-shaped instrument known as a curette. There's another variation called dilation and evacuation, where the procedure uses a suction technique instead of using the actual scraping. So this is in a case where there's a pregnancy that's not wanted and the mother is choosing to end it, or there's a medical indication saying this pregnancy is not a good thing and it might be high risk and it shouldn't be followed through, I guess would be the way to put it. So sometimes it's an elective procedure, sometimes it's medically indicated. Either way, the situation is the same. By the way, this is also done for pathologies of the endometrium. So it's not always associated with pregnancy. This might have a complete different reason that this is being done. But for whatever matter, it might be indicated for. DNC is how we refer to it, and that stands for dilation and curettage. Candidiasis. This is a vaginal fungal infection. It's caused by a type of fungus called Candida albicans. A curd or cheese-like discharge and extreme itching. This is what it would look like. This is what it would look like under a microscope. Usually, over-the-counter medications can take care of this, but in case it can't, it can also be treated by a physician. Preeclampsia. This is a condition that pregnant women can develop. It usually appears during the second half of pregnancy, and it's marked by hypertension, edema, proteinuria. The proteinuria is in itself pretty significant because it would indicate there's kidney damage happening. We shouldn't be seeing protein in urine at all, and if we do, it's most likely the kidney is breaking down or receiving some type of damage. If it goes undiagnosed, preeclampsia can lead to eclampsia, and the treatment includes bed rest and blood pressure monitoring. Can't emphasize enough for your patients, or for anyone else you may know who's at risk for eclampsia, to follow the guidelines during preeclampsia, and the situation can be controlled much better that way. If they're not, and sometimes even if they are, the resultant thing could be eclampsia. So the slide before is the precursor to this condition. This is a final severe phase of preeclampsia. It occurs when preeclampsia is left untreated. It can cause seizures. It can cause coma. It can even cause the death of the mother and the baby. This can occur before, during, or after childbirth. That's the remarkable thing. And that's why postpartum is important, that we watch mom's health for about 2 months after childbirth, because something like eclampsia could happen as a result of, or it could happen postpartum. So it could happen weeks after the pregnancy is complete, yet these symptoms present. And if they do, treatment's required. So this includes bed rest, blood pressure monitoring, anti-seizure medications. And yeah, it's a situation we don't want to see the moms get into. Any GYN I've ever talked to about this, OB-GYN to be more specific, has always said preeclampsia is really serious. We really need our patients to follow a protocol on those to avoid any risk to their pregnancy and to themselves. Most patients are compliant. Sometimes circumstances don't allow. If you want to avoid all of that, you have contraceptives. So these are agents to prevent contraception. I think we covered this in the male chapter, so we won't linger on this slide. One that we didn't cover there, though, is the IUD, the intrauterine device. Small T-shaped contraceptive device inserted into a woman's uterus to prevent pregnancy. the long-term reversible birth control method. So it can stand there for a long time and it can be reversed at any time. There are two types, the copper Paragard. When I was still working in clinical medicine, that was the choice of, I would say, 90% of the patients, because there are no hormones involved. So these, IUDs are often selected because the patient wants birth control. They don't want to take the oral birth control and have the side effects, and they don't want an unwanted pregnancy. So they'll pick the Paragard, which is made from copper, and that will take care of it. There's also the progesterone version, which is a hormone, and that's the Mirena or the Skyla. And now we have implants, which are a whole different thing, but those are once again a type of hormone therapy. So if the patient is trying to avoid hormone therapy, implants or the progesterone, being the Mirena or Skyla IUD, or oral birth control are really not indicated. Tubal ligation. Having the tubes tied, this is a sterilization procedure. Both fallopian tubes are blocked by cutting or burning them, tying them off. So if we looked at the techniques that are used for the vasectomy and altering the vas deferens so that sperm can't come through, tubal ligation is the same thing. It occurs in the female body. It's sometimes offered as a procedure during a C-section because they already have the pelvic cavity open, and they can perform the procedure really easily then. So sometimes they'll ask the patient, do you want to have tubal ligation at the same time we do the C-section? We covered all these already in our last chapter, so I'm not going to go over them again. You've heard me mention Pap smear throughout the lecture, and technically it's a Papa Nicolau test, a procedure in which a physician scrapes cells from the cervix and has them analyzed to check for cervical cancer. You're seeing the old school method here where they used to use a wooden spatula, and now they use a brush. Technique looks the same. They use that metal device you see there called a speculum to hold the vaginal canal open. It allows access to the cervix, and very much the way I described how a colposcopy is done. It's more or less the technique here, but instead of using pinchers to remove tissue, they're just scraping for cells. Of course, they're looking for abnormalities. The result of an abnormal Pap smear, like an ASCUS result or an LSIL result, those two acronyms, if they appear, that's likely going to lead to a colposcopy. And another pathology, PID, is pelvic inflammatory disease. This is an infection and inflammation of the uterus, ovaries, and fallopian tubes, causes scarring, can lead to infertility, ectopic pelvic pain, gonorrhea and chlamydia. We talked about STIs in the last chapter. They're the most common causes of PID, and this is the most common preventable cause of infertility in the United States. This is a very uncomfortable situation for the patient. It's their entire inside of the pelvic cavity is swollen and sore and very uncomfortable. These are the types of symptoms they're not likely going to be able to ignore. Nonetheless, if it goes too long without proper treatment, it can cause permanent damage, and infertility could be a result. And our final slide, trichomoniasis. Pardon me for stuttering there. Let me try that again. Trichomoniasis is a sexually transmitted disease caused by a parasite, Trichomoniasis vaginalis. The CDC considers it the most common curable STD. 3.7 million people have it. 70% of those are asymptomatic. So there's that word again. Pregnant women with trichomoniasis are more likely to deliver preterm, which means basically a premature birth is more likely if this condition is present during pregnancy. Once again, I apologize for all the stuttering I'm doing today. Probably not my best day to do lectures, but there it is. All right, there's our Chapter 8, Part 2, the female reproductive anatomy, just everything you need to know for next week's exam. So good luck with the studying, and we'll have the exam in a few days. And if you have any questions or comments, please let me know. Bye for now. We'll see you next week when we're going to pick up the final 2 chapters of our semester.